My presentation is entitled, An Evaluation of High versus Low Preferred Education-Based Stimulus Equivalence Protocols for Adults with Developmental Disabilities Outside the Educational System. An Introduction to Stimulus Equivalence. Stimulus equivalence represents an efficient method for training relations among stimuli that transfer to other stimuli without an explicit history of training. Relations among stimuli are typically trained in a match-to-sample format in which A, B, and C stimulus relations are directly trained A to B and B to C, and then tested for emergent or untrained relations between A to C and C to A. Emergent relations are those that are displayed in the absence of reinforcement or feedback. Stimuli that comprise an equivalence class that serve the same function rely on specific conditions or contextual control for how to respond to each stimulus. Otherwise, as Hayes 1989 reveals, all stimuli involved in an equivalence class would function as one stimulus class, without response variability. Research. Sidman 1971 conducted the first stimulus equivalence study with an aphasic patient who demonstrated equivalence of spoken words to pictures, but not to written words. Walker and Rayfelt 2012 tested for an untrained topography-based response, which was a written response, to improve the demonstration of emergent skills following training based on learning single-subject research designs. Feenup, Covey, and Critchfield 2010 utilized equivalence-based instruction to establish generative learning with college students learning about brain-behavior relations through a computer-based format via Visual Basic. The equivalence protocol was presented through a match-to-sample format and had students learn A, B, and C relations, as well as A, D, and E relations, which allowed testing for class mergers among B, C, D, and E relations that were only connected through A stimuli. Therefore, the purpose of the current study was to utilize an equivalence-based instruction protocol with a linear series design to extend the results of Feenup, Covey, and Critchfield 2010 and Walker and Rayfelt 2012 to adults with developmental disabilities outside the educational system. The current protocol included a test for emergent topography-based typing responses. An alternating treatments design was used to simulate natural learning environments in which classroom instruction typically alternates by day rather than being continuous. A preference assessment allowed for a direct comparison of duration per session for each protocol, as participants were able to determine the length of each session. Errors per minute per session was also added as an additional measure of preference. Method, participants, and setting. 3 adults with mild to moderate intellectual disability and autism participated in the following study. Their IQ scores ranged from 42 to 58. The setting was empty offices, classrooms, and a lunchroom at an adult day program in southern Illinois. These rooms were only used when other consumers were not in the area. Materials and measurement. Protocols were administered through Microsoft Visual Basic 2008 Express Edition and required a computer keyboard and mouse. Stimuli included pictures, text, and programmed consequences, which were sounds and points during training. These components were removed during testing phases. The independent variable was the random alternation of high and low preferred instructional protocols, which followed an alternating treatments design. The primary dependent measures were duration per session and errors per minute per session, which were used to indicate preference for each protocol. Percentage correct was recorded for each trial block during training and testing, with a 90% criterion for mastery. Criterion for pretest was 70%, which allowed for enough room to measure improvement in learning. This slide shows a sample of a stimulus presentation or one trial for a training trial block. The top and centered picture shows a sample stimulus, which is an A stimulus, above 3 selection stimuli, which are B stimuli in this example. Each trial block featured 3 sample stimuli randomly selected to be paired with 3 selection stimuli. This example shows Mercury, Venus, and Earth. Participants also received different sounds for correct and incorrect answers. Also notice the points box in the right corner. This slide shows an example of an emergent topography testing trial for typing responses. The contextual cue used is the position from the sun, with an example of a correct answer below it, and then the A stimulus and a blank text box are shown, which the correct response is a C stimulus comparison. Without the contextual cue, B stimuli responses would also be deemed correct. Protocols. The protocols in place were the solar system, anatomy, geography, and zoology. There were 9 classes by 3 terms for 27 stimuli per protocol. A stimuli were always pictures, while B and C stimuli were written names and facts, respectively. There were 3 comparisons per trial block, resulting in 12 trial blocks for each protocol, in addition to the test for an emergent topography. Procedure. First, participants were exposed to a sample instructional protocol which was used for inclusion into the study. Then participants went through a forced exposure to the instructional categories, in which each one was presented for 30 seconds. Then there was a paired stimulus preference assessment used to rank order preferences for categories. Participants continued doing the preference assessment until there were clear preferences for high and low preferred protocols. Then they were exposed to high and low preferred protocols, which were presented through an alternating treatments design and followed a pre-test, training, and post-test format. Last, there was a test for an emergent topography, which was typing skills, that went through A to C and C to B relations. This table shows the sequence of all experimental phases, beginning with assessment, moving to training, testing, the typing post-test, and then a maintenance probe. Only one participant completed the maintenance probe at the time of this writing. DJ's duration per session results. The first 3 sessions for the high preferred protocol exceeded durations for the low preferred protocol. Once the high preferred protocol was finished, low preferred durations closely matched initial high preferred durations. Also notice that there were only 4 administrations of the high preferred protocol before it was finished. DJ's errors per minute results. Errors per minute were far lower on average for the high preferred protocol than for the low preferred protocol, which also showed greater response variability. Also note the decreasing trend after session 3 for the high preferred protocol. Session 6 had the lowest overall errors per minute per session. DJ's low preferred results. DJ's low preferred protocol was geography. Percentage correct increased steadily during training, yet it took up to 10 trial blocks to criterion for some comparisons. DJ did not pass any of the initial post-tests, and it took as many as 5 retesting trial blocks to exceed criterion. However, all post-tests exceeded criterion for the low preferred protocol. Testing for an emergent topography or typing skills resulted in scores of 11%, 6%, and 67%. DJ's high preferred results. DJ's high preferred protocol was the solar system. Training scores resulted in a higher percentage correct than each previous trial block. Initial post-test scores for 3 of 6 post-tests exceeded criterion. After 1 retraining session, the remaining 3 post-tests exceeded criterion, all reaching 100% correct. Testing for an emergent topography or typing skills resulted in 17% and 67% correct. JG's duration per session results. Durations per session were all longer for the high preferred protocol until the final session of the low preferred protocol, which was comparable to the highest point of the high preferred protocol. Overall, durations for the high preferred protocol exceeded those of the low preferred protocol. JG's errors per minute results. Errors per minute per session showed a decreasing trend for both high and low preferred protocols, with a sharper decline and fewer errors overall for the high preferred protocol. JG's low preferred results. JG's low preferred protocol was anatomy. The initial exposure to training, A to B relations, resulted in extensive variability. Blocking was introduced on trials 21 to 24, and scores dramatically increased. The low preferred protocol required more trial blocks to criterion on average, and required blocking, unlike the high preferred protocol. No post-tests exceeded criterion during the initial exposure. While other scores increased following retraining, only 1 post-test exceeded criterion at 96% correct. The test for an emergent topography resulted in 0% correct. JG's high preferred results. JG's high preferred protocol was the solar system. Repeated trial blocks resulted in a steady increasing trend towards criterion and never required blocking. The initial exposure to the post-test resulted in 0 trial blocks exceeding criterion. All testing trial blocks exceeded criterion after the 3rd training sequence, with the exception of 1 trial block, which exceeded criterion on the 4th attempt. Testing for an emergent topography resulted in 6%, 61%, and 78% correct, which was the highest score of all participants. MS duration per session results. Low preferred durations were highly variable, with high preferred durations on a decreasing trend before increasing on the final 2 sessions. While duration data were unclear for determining preferences, MS had 5 sessions lasting 50 minutes or longer. MS errors per minute results. Errors per minute showed a fairly high and consistent number of errors for both protocols, with the exception of a very brief initial session for the low preferred protocol. Again, preferences were difficult to indicate with MS results. MS's results for low preferred and high preferred protocols. The low preferred protocol was anatomy and the high preferred protocol was zoology. MS required the highest number of trial blocks to criterion to pass training trial blocks and required blocking on numerous trial blocks for both protocols, especially for text-to-text comparisons. Only 2 of 6 post-tests exceeded criterion following retraining blocks for the low preferred protocol. Emergent topography scores were 17% and 11% for the low preferred protocol. Training required 21 trial blocks to criterion for the first text-to-text comparison, but the highest was 8 for the picture-to-text comparisons, although all others were 3 or fewer for picture-to-text comparisons. 4 of 6 post-test exceeded criterion, with 2 exceeding criterion after 1 retraining session, and 2 others took 3 and 5 exposures to exceed criterion. Emergent topography scores were 0% and 11% for the high preferred protocol. Summary of results. 2 of 3 participants showed evidence for preferences. Training typically resulted in steadily increasing percentage correct, with a few exceptions. Retesting following retraining followed the same trend. Evidence of emergent topographies for 2 of 3 participants, with scores of 67% for high and low preferred protocols for DJ, and 78% for the high preferred protocol for JG. In addition, all participants verbally stated a desire to continue working on computer protocols, although only one specified which protocol, and that was DJ. Discussion. The results of the study extended Phenop-Covey and Critchfield 2010 and Walker and Rayfelt 2012 to a new population, compared performance on high and low preferred protocols, tested for an untrained topography, and introduced an alternating treatments design for studying stimulus equivalence. The preference assessment and measures identified high and low preferred protocols for 2 of 3 participants. Computer-based instruction resulted in the emergence of equivalence classes for 2 of 3 participants. DJ for both protocols, JG for the high preferred protocol, with 1 of 6 for the low preferred. MS had 4 of 6 post-tests for the high preferred protocol exceed criterion, with 2 of 6 for the low preferred. In addition, there was evidence of emergent topographies for up to 78% of stimulus relations for one participant, and 67% for another participant, which occurred for his high and low preferred protocols. Scheduling of sessions also followed each participant's routine and daily schedules at day training to ensure that the experiment did not interfere with work or other preferred activities. Preferences. There are important differences between the preference assessment used in this study and Fisher and colleagues in 1992. The selections made by the participants did not result in tangible access to a preferred stimulus, but instead produced pictures used in each protocol. Also, the selections made by the participants were not delivered as consequences for behavior, but were instead used to gauge preference for working on selected protocols. Thus, it was important to assess if the preference assessment used related to participant preferences, otherwise its use in future studies and programs would be superfluous. In any case, low preferred options did not appear to be synonymous with aversiveness, which would have been a concern. Limitations. While preferences were assessed, it is difficult to compare results against varying difficulty of high and low preferred protocols, which were likely different for each participant. Duration and error measures may not always represent preferences as well. The length of time between sessions for a high and low preferred protocol could have inhibited or facilitated equivalence class formation. There was not an analysis of the length of time between sessions in this study, however. Regardless, an alternating treatments design helped simulate a classroom learning environment. The salience of A stimuli, which were pictures, also may have been a concern. These stimuli were likely more salient, and 2 participants committed more errors during text-to-text comparisons than for picture-to-text comparisons. Directions for future research. Future studies could compare the effects of different experimental designs relating to the formation of equivalence classes. They could also investigate the role of various training designs. This study used a linear series design, but many-to-one and one-to-many designs could also be used. Future studies could also add more components to enhance participant preferences, and these could be assessed before beginning the protocols. Future studies could utilize different measures to gauge participant preferences as well. Furthermore, future studies could examine the role of changing preferences with different availability of variously preferred protocols. There was some evidence of substitutability between high and low preferred protocols in this study. Choice-making and habilitation. The study remained consistent with the recommendations from Bannerman and colleagues 1990 in that it facilitated participant-directed learning opportunities, provided measures of preferences, and allowed for the right to options and the right to refuse through self-directed session links. Of course, at its extreme, allowing too many options and allowing for complete refusal can lead to ill-advised choices by clients, such as unhealthy and risky behaviors, as well as general ennui. Therefore, increasing the well-being of clients and those who work with them can be enhanced by identifying and providing programs, as well as activities that are based on client preferences.